So, pleasant day, Mr. Agapino Aguila Jr. I am Lovely Allen. Today I'm going to perform to you my routine demonstration of assessing the abdomen. So, the very first step is to ask the client's name. So, sir, what's your name po? It is so it ensures that we're going to do the procedure on the right client. Next is to do hand hygiene to prevent the spread of microorganisms and to maintain a clean environment for our clients. Next is to assemble the equipment and supplies, the light, the tape measure, the pen, the doctor notebook, and the marker and the stethoscope. So this ensures a smooth and efficient assessment, minimizing interruptions and ensuring accurate measurements and observation. Next is to introduce to the client and explain the procedure. So, sir, today po mag-assess po ako ng abdomen nyo. And I am going to ask the client for a recent abdominal pain. So, sir, nakaka-feel po kayo ng abdominal pain this past few days. And sir, nakaunite na po ba kayo? Yes, sir. So, a full bladder causes discomfort during palpation and may alter the accuracy of the findings. Next step is to assess the client to a supine position with the arms placed comfortably at the sides. So, it provides the optimal access to the abdomen for iopepa or inspection, auscultation, percussion, and palpation, and it prevents unnecessary muscle tension. Next is to place small pillow beneath the knees and the head of our client. So it reduces the tension in the abdominal muscles. So next is we're going to expose the client's abdomen from the chest line to the pubic area to avoid chilling and shivering. And we are going also to drape our patient to avoid any tense on the abdominal muscle. Expose na po siya. And drape natin yung patient natin. Next is we're going to start our assessment, which is the inspection. So we're going to inspect the abdomen skin integrity of our clients. So we're going to note the color. So there are no discoloration noted or observed in our clients. So it helps identify any abnormalities such as bruising, discoloration, or signs of underlying conditions. Next is to note vascularity of the abdominal skin. Increased vascularity indicates liver disease, portal hypertension, or other circulatory issues, while decreased vascularity could be a sign of poor circulation. So no dilated veins present and no cirrhosis of the liver observed. Next step is to inspect for striae, scars, lesions, and rashes. So we do not observe any striae, scars, lesions, or rashes on our patient. Next is to inspect the umbilicus, its location, and assess the contour of umbilicus. So the umbilicus is in the midline, you can see, and at the lateral line, rounded. At the end inverted, also the umbilical skin tone are similar to the surrounding abdominal skin tone. Next is to inspect the abdomen for the contour and symmetry. So we're going to sit down beside the patient and look across the abdomen at the level slightly higher than the client's abdomen. So the contour assessment helps identify abnormalities such as distensions, covered abdomen, or fusion. So the findings on our clients is the abdomen is flat and symmetrical. Next is to observe the abdominal contour while standing at the client's side when the client is supine. So viewing from this position provides a better perspective at the abdomen that may not be visible from a frontal view. Next step is to ask the client to take a deep breath and to hold. Holding the deep breath makes a certain abdominal structures more prominent and easier to access. So here, um, um, so there are no abdominal masses and bulges observed. Next is to assess the symmetry of contour while standing at the foot of the bed. This provides a broader perspective to detect asymmetry, bulging, or localized swelling. So there are no asymmetry, bulging, or localized swelling observed. Next is if this tension is present. Measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. And this provides an objective baseline to monitor changes over time. So I will not going to perform this one because our patient doesn't have any distension present. Next step is to observe abdominal movements associated with respiration, peristalsis, and aortic pulsations. So abdominal respiratory movement may suggest peritonitis or guarding due to pain. So there are no any abnormal movements associated with the respiration of our patient. Next is to observe aortic pulsations. A strong, widened, and displaced pulsation could indicate an abdominal aortic aneurysm or other vascularities abnormalities. There are no abnormalities noted or observed. The next is to observe for peristaltic waves. Exaggerated waves may indicate bowel obstruction, particularly if they move in a rifle-like motion. There are no any abnormalities observed. Next is we're going to proceed to auscultation. So we're going to auscultate the abdomen of your bowel stance. So the very first step is we're going to warm the diaphragm of our stethoscope to avoid startling our patient. So we're going to perform the 7 points because bowel sounds indicate intestinal motility. So we're going to so there are no hyperactive bowel sounds heard. Next, we're going to also take the abdomen for vascular sounds. So this time we're going to use the bell. We are going to place it at the abdominal aorta, which is in the big line. So listening over major arteries helps detect bruise, which may indicate turbulent blood flow. So warm natin muna before natin i-place. So there are no abnormalities heard at the abdominal aorta. Next is we're going to auscultate the abdomen for peritoneal flexion rub over spleen and liver. So a flexion rub over the spleen or liver suggests inflammation and of the peritoneal surface. So we're going to start at the spleen. Next is in the liver. Next is we're going to proceed at the percussion. So we're going to percuss the tone of all quadrants. So percussion helps assess the distribution of symphony and dullness. So we're going to perform the 13 points percussion. So the finding is tympanic sounds are heard over the stomach and intestine. Dullness sounds are heard over the liver and spleen. Next is we're going to forecast the liver to determine its size. So we're going to start above the nipple or middle clavicular line. Then we're going to um, mark the down cells. Next is we're going to start at the right lower quadrant, going up, then mark the down cells. Then we're going to measure to determine the size of the liver. So the size of the liver of our patient is 6 centimeters. So the normal size of the liver may range from 6 to 12 centimeters. Next is we're going to percuss the spleen, begin to steer to the mid-axillary line, then percuss downward. The spleen is normally not percussible unless enlarged. So dullness over the spleen may indicate splenomegaly, but our patient doesn't have any um, abnormalities during the assessment. Next is we're going to perform blunt percussion on the liver and kidneys. So place left hand flat against the lower right anterior rib cage, then use ulnar side, this one of the right fist to strike. So blunt percussion helps assess for tenderness, which may indicate inflammation or disease. Next step is to perform light palpation. Right here at the palpation assessment already. So we're going to perform light palpation first to the three areas of tenderness and muscle guarding beginning in a non-tender quadrant. So we're going to ask the client if pain is felt during palpation. We're going to start at the right lower quadrant. So we're going to starting in a non-tender area prevents unnecessary discomfort. So sir, sabihin mo po sa akin if may masakit po ka sa palpation. So, pero may masakit ba? No. Next step is to perform the systematically explore all four quadrants. So this ensures no area is missed and allows for comparison between quadrants to detect abnormalities. So I already performed that one, so we are going to proceed on the next step. So perform deep palpation over all four quadrants. We're going to use the 13 points starting at the bottom of the umbilicus right lower quadrant going clockwise. This assesses deeper structures for masses, organ enlargement, or abnormal fluid accumulation. Ano sabihin niyo lang po, may masakit ka lang? May masakit ko? Next is you're going to palpate for masses, umbilicus, and surrounding area for swellings on bulges masses. This helps identify potential concerns such as tumors, cysts, or fluid accumulation. Next step is to um, helping the liver to detect enlargement and tenderness. So we're going to perform the curl hook by placing the fingers of both hands over the edge of the right costal margin. Ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers. So, start. Ano po tayo ha? Nang malalim. And exhale. Next is to palpate the liver to detect enlargement. So the liver doesn't have any enlargement under the nest observed noted. Next is to palpate the spleen. So stand at the client's right side and reach over the abdomen with your left arm and place your hand under the posterior ribs and pull up gently. Place your right hand below the left costal margin with the fingers pointing the client's head. So we're going to ask the client to inhale and press inward and upward. So usually the spleen is not palpable. If it is palpable, it may indicate splenomegaly. Next is to palpate the kidneys. So support the right posterior flank with your left hand and place your right hand on the right upper quadrant, just below the costal margin at the middle clavicular line. So ask the client to inhale, then compress your fingers deeply during deep inspiration. So palpation helps detect kidneys enlargement, tenderness, or abnormal masses. So palpate natin yung kidneys. Yes, sir. Yung malalim. And exhale. Kabilaan po. So, next step is to palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. A distended bladder may indicate urinary retention, obstruction, or neurogenic bladder dysfunction. I will not do this step because our patient doesn't have any urinary retention or distended bladder. Next is we're going to document the pertinent findings in the client's record. It is always good to ask that what is not documented is considered as undone. Next is we're going to palpate for possible appendicitis. The current tenderness in the right lower quadrant or Malvern's point suggests appendicitis. So there are several procedures, which include this one. So assess for rebound tenderness. Palpate deeply at 90 degrees into the abdomen, halfway between the umbilicus and anterior iliac crest. Then release pressure. Ask the client if pain is felt during pressing or releasing and where the pain occurred. So rebound tenderness suggests peritoneal irritation commonly seen in peritonitis or appendicitis. Sister, tawag ko ha. Di masakit po, sir? Next is we're going to assess for fluid rebound tenderness or roughing signs. So do rebound tenderness at the left lower quadrant. So roughing sign is positive when palpation in the left lower quadrant causes pain in the right lower quadrant, suggesting appendicitis. Next step is we're going to assess for PCOS sign. So we're going to ask the client to raise the right leg, then instruct to keep it elevated while you push the leg downward. So ask if abdominal pain is felt. So pain with the hip flexion or extension indicates irritation of the PCOS muscles. So sir, elevate lang po natin yung legs dito. So push ko po sir ha. So, feel mo ba kayo abdominal pain? So, there are no abdominal pain. Okay. Next is we're going to assess for obturator sign. So we're going to position the client in lateral lying, then support the client's right knee and ankle, flex the hip and knee, and rotate the leg internally and externally. Pain with internal rotation of the client's hip suggests irritation of the obturator muscle. So, sir, dito po sa sir, ano po, thank you so much. Thank you, sir. So, may complaint po ba kayo sa abdomen niyo po during the procedure? Sure. So next and last step is to assess for Murphy sign. So we're going to apply pressure at the liver border, which we have just measured before. Then we're going to ask the client if pain is present. So a positive Murphy sign suggests acute cholecystitis due to gallbladder inflammation. So sir, may masakit po. May masakit po. Sir, so um, that's all the presentation. Thank you for listening and watching Sir Agripino, and God bless po.